All right, kiddies, thanks for joining us. Sorry about the delay, technical issues on both sides. I had to reboot because my system shit itself completely, and Jess's system was doing whatever it was doing. Anyway, we're here. Fuck it, it's all good.
Yeah. Hello.
So, Happy New Year to you and all of yours.
Is this our first or second podcast of the year?
It's our first one this year, I think.
Oh, yay.
Yes.
Happy 2025.
Indeed, yes. So today the focus is on the health of your nervous system, what goes wrong with it, how can we sort that out. Basically, it's all up to you, Jess. There's no pressure, but I'm going to shut up and let you tell us all about it.
Oh, yay. Welcome, everybody. You guys have probably obviously met me and Bart a number of times before because Bart and I actually have a big history where Bart was my professor at university back in the day. And then we reconnected in like the last 4 or 5 years. Obviously, Bart introduced me to the carnivore way of thriving. And I have been carnivore for strictly since January 2022. So 3 years now strictly. And for a year before that, I was going heavy meat-based and just reducing out my plant and vegetable matter. So, we are great friends. I know him very, very well. And in the last few years, the other thing that has transpired between Bart and I is that he's been doing some work with me on his own body, on his own nervous system and his brain to help him restore some issues that he was suffering from teenage days of when he was in a motorcycle accident and came off his bike and smashed his shoulder. So the original problem that Bart and I were working on was a really debilitating, very atrophied, very weak, feeble shoulder. Bart, being an amazing human as he is, had done all the things that he could do on it to get it to the state that he could. But when he and I got together with this, he was in a situation where he couldn't lift it into the space. He was in a lot of pain. He was sleeping with pillows propped all around the arm. And in about 4 to 5 online sessions, he had full range of motion, full strength, full function, didn't have to sleep with pillows anymore, and had completely restored the use of the neuromuscular side of his shoulder, which was pretty cool. And so that's kind of how we kind of started working together. So although Bart was my professor and obviously knew and knows far, far, far more about humans than I do,
Some of them.
it was a really cool little flip around because I was able to actually help support him with something that he wasn't able to heal from himself. So that was kind of how Bart and I got into working together. Since then, we've done a lot of work over the last 3 years on different parts of his body, depending on what he's been troubled with. Last year, he had a snapped Achilles tendon, which he did at cricket. And we obviously restored a lot of function to that virtually online, with him kindly being our assistant and me coaching her through specific positions to restore his ankle and foot recruitment capacity. And thanks. And then he came up and did some in-person treatment because he had very poor functioning hamstrings. So his knee flexion was pretty much non-existent. And we used some really awesome little tools to measure the force output of his hamstrings. And Bart loves that kind of stuff, being a scientist. So he loves having all the tangible data of like how much force can he generate from his knee. And then we treated a whole heap of stuff, and then we saw the improvements in his output go up by, I think it was more than double on the hamstring.
Yep.
It was insane changes in his force and his control and in the mobility of that joint. So this is the kind of side of the world that I work on. I work on the nervous system and brain, or essentially on the non-conscious system. And we were talking about sensory information coming in, being if we have a lack in that sensory system, an insufficient sense of an area of ourselves, then guess what? We have no control over that area of ourselves. So that is the side of the health that I work in, and it's been absolutely life-changing and amazing for me. And I just feel so blessed to be able to do this all day long. So we get to help people with real debilitating non-curable issues, typically issues that people have tried to get support or help with. And they finally found me, and we've been able to restore function to the area and get to the root cause of their problems. So that's kind of a little bit about me in a nutshell. The nervous system and brain literally affect everything. Everything. I call it the umbrella of everything. Tightness, weakness, pain is all nervous system. Okay? And we're led to believe that we might have an alignment issue or poor recruitment in an area, and that's what we believe is the problem most of the time. But what I'm saying is that all of those issues, tightness, weakness, and pain, really stem from weaknesses in the neuromuscular system, which is the brain to the muscle. And actually, if we can restore function to those areas, we can get rid of your pain, tightness, and weakness very rapidly, as Bart knows, very, very rapidly, and you get to keep the results of that.
Yeah.
So, we just wanted to jump on today and talk a little bit about nervous system health and how it affects us, because I think we believe that all of these problems are isolated. I've got a gut issue, a digestive issue. What is that controlled by? Our autonomic system, our vagus nerve. And if that's weak, we won't be able to digest well. And that's even if we're eating steak and eggs and all the good things, we can still have trouble with digestion and issues with weight, issues with our blood pressure, issues with our blood sugar regulation, and even our hormonal regulation can be affected by the nervous system. My hubby running around in the background. So,
yes, say good day to the boy for us. Hello, Ants. How are you?
Gone. Been and gone.
Been and gone, as usual.
In and out.
Yep. Well, there you have it. So, I mean, the other issue that comes up for me as well, just that we can talk about a bit, I'm quite happy for us to do so, is it turns out that I was actually induced at 8 months of gestation, primarily because my mother can't fucking count. and she told the physician...
No way.
Well, she told the physician when she thought the conception was. It turns out that conception was an earlier pregnancy that didn't take.
Oh.
And she thought that I was that one, and, I was overdue. And so they said, oh, well, bugger it, we'll induce him. And so I was induced at 8 months gestation with an immature nervous system. Hence all my physical issues as a young person with coordination. Sport has been a lifelong difficulty for me to actually be able to control my body and know where my shit is in space kinesthetically and all of that.
Yeah.
Stuff like playing guitar and all that sort of stuff, or any musical instrument, anything that's like physical, needing really good motor programs, struggle.
Yeah.
Are these things that the Neuro Reset Technique can impact? And if so, how so? Without giving away the game, how does that work? What do we do?
Yes. So weaknesses in the nervous system and the brain, because it's both, no matter how it comes about, that could be from like your issue. It could be from, let's say you missed a developmental stage. Let's say you go from sitting straight to walking and you never crawl. Our nervous system is strengthened through repetition of action, i.e. when I'm going through those crawling motions, I'm sending and receiving information to tissues or systems of tissues. And as I do that over and over, I gain more strength and control over that nervous system. So if you've skipped a developmental issue, you can imagine how many pathways are getting neglected, so to speak, and not getting strengthened and optimized because you've literally skipped them. Then fast forward, 20, 50, however many years down the track, that you have lack of sense of control in certain areas of your body that were never filled in at a non-conscious level. And now you have real difficulty controlling those parts of your body. It could be you lost that sense of yourself through an injury, i.e. you snapped something, you injured something, it could be surgical. They've cut through tissues. It doesn't matter how you lost that control of your body, we can give it back to you. There's only two ways that we can't, and that is with bone spurs something that we don't work with, and with involuntary spastic contractions, right? Because it's a part of the brain and the nervous system that we're not able to restore. But we can work with cerebral palsy, multiple sclerosis, degeneration of the neurological side, stroke, post-surgical, post-injury, etc., etc. Okay? So it doesn't matter how you lost it or whether or not you were never born with it in the first place in your case, but we can restore strength and control over that area of your nervous system and neuromuscular systems. The way that we do that is by using this amazing tool called Neuro Reset Technique, which I discovered 13 years ago when I was already a very, very high profile trainer. I was very good at my job. I thought I knew all the things and thought, at university, I had learned enough to really be able to help people. What I kept seeing though is that I could help people put on muscle or lose body fat pretty easily as a very good personal trainer. And I'd done a ton of post-grad stuff after university as well. I was always looking for better, not just for myself, but for my clients. And what I found was if someone was injured or someone had, say, a long-standing postural issue, let's say they've got some kind of kyphosis in their spine, that I was very limited on how I could help support that person. And so, you try and adapt the exercise, change the angles, use a cable, etc., to try to modify around someone's injury. But what I was seeing over and over again, probably 9 times out of 10, was that if I sent them off to another practitioner, physio, osteo, etc., that what I kept seeing was that people's problems were getting worse, or they pretty much stay the same. They might improve a little bit, but it would take a really long time, if at all. So I was kind of looking for something more than what the current industry was providing. And that's how I came across this very rare form of neuromuscular treatment, which was created by someone called Simon Frost. He is a UK-based human. And I was very blessed to be able to learn this technique to actually be able to restore strength, control, and function to somebody's body instantly. And I mean, straight away, and that those results would continue to last. So I got my head blown off, so to speak, of what I thought that we could actually do. And then when I saw this technique, it blew out everything that I thought I understood and knew about human function and, how you can actually dramatically change somebody's life pretty quickly. That's kind of how it came about. I stayed in London then and did all my specialty training for 13 years. And still study today. So every Wednesday I do an hour to 2 hour lecture with Simon Frost, and I will do treatment on myself. I'll learn any bits that I'm currently learning the next pieces of, as well as if there's anything that I need to troubleshoot in terms of clients that I'm currently working with. So I'm always up leveling. I'm always learning and growing. This is not something that probably will ever end. I'll probably study until I die, because as we learn new pieces, we're able to support people with new parts of things.
I can imagine how that discussion goes. Simon, I have another problem with Mr. K. What do I do? Simon would probably say, ditch him. Get rid of him. He's a pain in the ass. Who knows?
It's funny that you say that, though, because if you think about where we started with you, we started with restoring those 3 major sensory things that our body needs to know about. And that is, where am I positionally? Where am I moving? And how much force is required to move my arm? So those 3 main receptors are giving us information all the time about our current status. Okay, so Bart's sitting there, his arms here, his legs there, and all of the time he's getting information to his brain telling him about where he currently is in space. Then when he wants to do something and actually move his arm, then we're sending signals to tell the body what to do. So without the sufficient information we can't control the part of our body properly that we're asking ourselves to control. And what happens is compensation, i.e. muscles that are working already and neuromuscular pathways that are strong will get more overloaded, and the weaker ones will become weaker, and the imbalance becomes greater.
Yeah. So my problem was aberrant information, false information coming into my brain as to where any of my segments were in space. Without the use of my vision to look and check, I had no idea where anything was at all. And ergo, how could I possibly know what I need to do to move it to somewhere else, or how much force was required, how many muscle fibers need to be innervated, etc. So what Jess is talking about is the technique that she uses to, well, it's called Neuro Reset Technique for a reason. Basically, it's like a hard Control-Alt-Delete on your nervous system in particular facets. This muscle group, that muscle group. And I guess overall, once you've done enough of those in various segments of various things, you've just got so much more control and inherent knowledge over where everything is at any given time. And for me, it has been life-changing, absolutely life-changing. I've done quite a bit of work with Jess over the last couple of years, on and off. And that's the other thing is that once you've fixed or repaired something, that fix or repair doesn't dissolve. It remains with you. It's I hate to use the word permanent, but you do get to keep it.
Yeah, we technically can't use the word permanent. We say long-lasting because we don't know, right?
Nothing's permanent. Yeah, nothing's permanent.
We know that, say, for example, we're meeting deltoid, right? As long as once we've restored your brain's ability to know where is this, where is it moving, and how much force is it required. There's other receptors, but those are the major ones. Then you'll be able to continue to go into that space. And as long as you continue to use that part of your body, you will keep strength and control over that area of your body. If you atrophy or don't use that area, then yes, you can reduce your ability to sense that part of you. But it's unlikely to occur if you keep moving through your full joint ranges after treatment. On 2 occasions, I've seen people lose function after we've restored something. The first time was when someone's retina detached. So his retina detached and his whole nervous system shifted.
Right.
That was quite incredible. And we just put everything back in, and that was easy enough to do. The second time was through surgical severing. So one of my clients had a double mastectomy. We've obviously cut through a huge amount of tissue of areas that we've already restored function to, and so that we had to redo that. But other than that, we see that this area that we've worked on Bart's body, whether or not it's virtually or in person, he will see that still strong functioning and full control over that area.
Yeah. And I think that's also something that we have mentioned it a couple of times, that we should probably make it really clear, is that while it's always best in-person hands-on to receive treatment NRT-wise, you are able to do this virtually over the Zoom, sometimes with help from the lovely Pim or whatever, or whoever else might be around with you guys.
Yeah.
Just in terms of manipulating different joints into the right place and all of that to do the right activations and stuff.
Mm-hmm.
But, I mean, as it is, correct me if I'm wrong here, Jess, you are one of about 20 people in the world who know this technique.
Yeah, there's only 20 practitioners globally. There's only 3 specialists, which I'm one of. And basically the difference is a practitioner might be qualified to treat certain systems in your body. Let's say trunk and torso, or shoulder, cervical spine, or hip and knee, foot, or hand, or etc. Or you can be certified and qualified to treat every single receptor internally or externally in the body, and that's what I do. So there's 20 of us globally, but not all 20 of us are able to do every single thing. And I think there's probably only 3 or 4 of us that do online as well, because it is challenging to do online. Not challenging as in it's hard, but I have to coach you into very specific divisions of tissue in order to do the reset. And we use a couple of specialized pieces of kit as well at the same time. So it works, it's just slower because I've got to coach you into position, whereas if you're in person, I can just put you there. So when we learned to do this, to do the online work, that was in 2020, and that was during the crazy lockdown that started happening in the world. And that was actually when I just started to do my assisted teach. So I just started assisting teaching NRT to other students. And that's when the lockdown happened, and that's when I learned to do this online. So I'm really grateful for that because it means that I work with people all over the globe and that it does work. It might be slightly slower than in person, but it's just as impactful and effective online. And we can even do that. We can treat something, and we have done this part. We've treated something online, and then we've tested it hands-on, and it's solid. So we know that we're able to recruit pretty much all of the muscles that we're trying to online. The parts that we can't do online is, you haven't had this yet, my friend, but we've got all new ligament treatment.
Oh, that sounds fucking delightful.
It's gnarly, holy moly. The changes in strength and control and mobility, though, are, like, frankly, incredible. Like, really, really, really cool. And there's a few other new pieces that have come about that are hands-on only. But, yeah, other than that, we can pretty much treat anything virtually.
Awesome, yeah. Including, you can actually treat psychological, emotional stuff as well.
Yes. Oh, my God.
Which is another incredible thing, I think. But, there you go.
And you don't... Are you okay with me to share when I did it on you in the impact?
Yeah, absolutely open book. Yep.
Yeah, okay. So 2 years ago, December 2 years ago, I learned the mind side of NRT. Before that, prior to that, it had all been bodywork stuff. You got a spinal cage, you got a slip disc, you got tennis elbow, you got a snap tendon. I can do any of that, and I could do it confidently quite easily. Back pains, pelvic floor issues, respiratory problems, headaches, migraines, cluster migraines, head injuries, concussion, all this stuff, right? And then in December 2 years ago, I opened a can of worms, which is I started learning all about the vagus nerve. And the vagus nerve is the nerve that controls all of our autonomic processes. So that means our heart beating, our lungs, breathing, our digestion, all these things are happening without our conscious thought. And it's controlled by something called your vagus nerve. Our vagus nerve, when weak, can cause a number of problems, including like mental issues like depression and anxiety and overthinking and all sorts of different issues. And there's heaps of different programs out there to strengthen your vagal nerve. Okay, but one, how do you know that it's weak? Two, and which part of the nerve is it weak? Because there's a ventral and a dorsal branch, and they control different parts of us. Where is the weakness in that part of the nerve? And then once we identify it, we can actually strengthen that individual part of the nerve so that when you're not thinking, this nerve is strong, it's robust, and it can do its job. And so when I started learning the mind side of it, oh my God, I was like, oh Jesus, this is opening up a huge, huge can of worms because we're going into the mind and what has happened to us and how that experience has shaped us and shaped our nervous system from a non-conscious level. So when I started doing this stuff with Bart and started teaching him a bit about the vagus nerve and resetting different parts and finding out where he was weak, one of the things that we identified was that although we had strengthened his actual body in terms of the musculatures that were weak and the nerves that were weak to his knee or to his shoulder, the somatic sense of that's your feel sense, that's touch, that's, recruitment and shortening, our somatic sense of our feel, his shoulder was solid. We'd treated every joint, every muscle, every skin, stretch, fascia, ligament, all the pieces. But when we went into his mind and we looked at, is there a trauma attached to this injury, we could clearly see that it was weakening Bart's nervous system. And what we did was we tested his body, we looked at his generation of force and how much he could actually produce out of that tissue. I didn't touch his body, nothing at all. We then came up to his mind and we looked for the weaknesses in his mind around that trauma. Now, depending on how the trauma happens to you, is going to depend on where the nervous system weakness or the trauma has wired itself into you. And for example, with Bart, he had crossed the bonnet onto the road, smacked onto the ground, and hurt his shoulder. Somatically, checked the joints, muscles, it was all fine. Tested the trauma and found weakness in that area. And that was actually in his mind, not in the physical self. Strengthened that, didn't touch his body at all, came back down and retested and saw massive improvements in his strength output. And that wasn't even with my hands on his body. That was just working on the trauma wired into him. Now, as I said, depending on how it gets wired up, let's use a car accident, for example. It's nice and easy to think about. If I'm driving a vehicle and I am in a car accident and I smash my shoulder up, that somatic sense is one area that's probably going to be weak, yes. But what happens if I flipped the vehicle in that car accident? And now in our vestibular system, which is in our inner ears, there's trauma wired into our vestibular system. Let's say we saw something horrific. Someone flew through the windscreen. We've now got trauma wired into our ocular system, which is our visual system in our eyes. So it can wire itself into different receptors in our nervous system depending on what happened when we went through the trauma. But we can actually, with NRT, we can assess it. We can actually look at where is it wired and then strengthen each piece. And you can see what's happening during the treatment because those areas don't shut you down and dysregulate you anymore. And that's what we did with Bart. And actually, one of his big issues was in his auditory system and his sound. And it was the sound of him hitting, was it the bonnet or the ground? I can't remember now. Might have been the ground.
Front teeth on the ground.
There you go. It was the sound of the impact, not even the physical impact itself, that was wired up and affecting his ability to use that area of his body with full strength and capacity. So the mind stuff is so potent and powerful and affects the body obviously directly because they're the same thing. Nervous system and brain and body is all one. I think we're quite reductionist to think that this is separate from this and this is separate from this. Like they're all intertwined together.
Yeah, absolutely.
So
cool.
Yeah, the mind stuff is potent and powerful. We can obviously help people with lots of different things. And this is where I get people that have been carnivore for 5 years to come see me because they're like, I can't lose body fat. My digestive system's still a shit show, frankly.
Literally.
Yeah. I've got rosacea, I've got inflammation, I'm having heart palpitations, my digestive system doesn't work, and I'm storing excess body fat, and I'm a carnivore and have been for 5 years. Help me, what do I do? And that's what I get people who have done all the right things for themselves, but their nervous system is weak, or their brain is and their nervous system is weak. And actually, once we strengthen those parts, guess what? You can operate your body. Your digestion starts to work. Your blood sugar levels regulate. Your hormones regulate. You drop body fat. And all of your problems seem to just fade away because actually your issue was in your nervous system. It wasn't in what you were eating. It was in your body's inability to digest and absorb those nutrients. Yeah,
absolutely. Cool. Let's deal with Coach Joff's question here because it's a really good one. From my point of view as the patient receiving the treatment, and I'll say receiving the treatment with those because you're not receiving anything. NRT is a very physically active process. This is not come and lie on Jess's table and be manipulated. No. This is hard physical work. So, Joff, it's not necessarily pain, although some things can be painful if you put a joint into a position it's not happy with. So there's an acute pain thing that can happen, and we can release that, or Jess can release that. But if there's a discomfort across the board, it's that this is not a passive modality. This is hard physical work. You end up hot, you end up sweaty, you end up going pink in the face. There is a lot of control of breathing required as well, at the same time as putting stuff in the right place and doing the right things and all of that. It is physically exhausting. If you do NRT, even once you've done quite a bit of it, for a 2-hour session with Jess, you will be absolutely fucked, my friend. Promise you.
Yeah. And what Bart's saying is like, because we're working directly with the brain and nervous system, it's taxing on the brain and the nervous system. How often do we work out our nervous system? Never, right? So some of these weaknesses are so weak that when we're restoring function and control to them, it will wipe you out. Like, it's super tiring. Other areas are nice and seem reasonably easy to treat, but it just depends on the amount of weakness in you and in your nervous system, depending on, how uncomfortable it is. What Bart's saying is truly correct, though. Let's say that you weren't able to go into overhead flexion because you didn't have that ability to do it, and within literally minutes, you're now able to get into that space that your body hasn't been in. It can be uncomfortable, and it can be tight, but very rapidly you'll find that as we fill in your sense of control of that area, the tightness will go away because the defenses come off. So it's usually only short-lived. Obviously, if you've got a torn or snapped tendon, which we've worked with Bart as well, that, some of the positions can be very uncomfortable. We will manipulate, twang, pull on, etc., different tendons and ligaments to recruit those tissues. So in terms of, like, let's say you've hurt yourself and you're going to physio, this will actually help your physio be more, one, effective, because you can recruit the muscles. You're not trying to strengthen something that you can't even access. Two, it will be less painful. Your recovery will be faster and you'll get stronger faster. So this stuff you can use in conjunction with other modalities to actually make them a smoother sailing for you to get through them with more ease and grace. But yeah, if you have had surgical wounds as well, like, obviously there can be weaknesses in the skin, in the myofascia, in all different levels. So once we treat all of those, you'll be pretty comfortable in yourself. Why there's so few NRT therapists? That's such a good question. And the answer is because there is only one of Simon Frost, the founder of NRT. And yeah, it takes a very long time to learn it. You have to be recommended by an NRT practitioner to even be able to learn it. So I have personally recommended 4 practitioners, and all 4 have gone through and been trained in NRT. But if you don't know one of us 20, then it's very unlikely that you're going to get an in to actually be able to learn from this human. He doesn't run private mentorship programs like he used to either. So he's massively busy. We all are pretty rammed. And so there's not a lot of time for him to be teaching and coaching other practitioners. Another reason is because Simon's very selective about who he trains. Okay, it's a big responsibility, this job, to actually be able to, like, do what we do and hold what we hold and help the people we help. He doesn't want a whole heap of egotistical humans that are just there to be like, oh, look what I can do. Oh, I can turn your muscle back on. Oh, here I can do, like, he wants people that actually genuinely care. And it takes a certain type of person to become a specialist in this modality. It is very hardcore in terms of learning. Like, the divisions of tissue, for example, between your hip and your knee, there's 1,600 divisions of tissue in that area, and you have to know how to reset all of them. And so when I started this 13 years ago, I thought, oh my God, I'm never going to be able to learn this. Like, it's so in depth. It's so specific. And obviously we have manuals that we can follow. And that's what I did in the early days. I used to sit with my manual and be like, right, okay, adduct, medially rotate, do, invert, do whatever I'm doing. Okay. And then do that, and then look at the next piece. And that's how I treated for a really long time. And it doesn't matter. It's effective. The client doesn't care whether or not you're referring to your notes every couple of minutes. But now that it's all in there, I can just boom, 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 go through a whole system of tissues rapidly and restore function really, really quickly. So yeah, that's a couple of the reasons that it's not spread out there widely yet.
Awesome. Right. Well, I've got something else at the top of the hour in about 8 minutes, so we will need to close off there. Look, it's been absolutely invaluable, once again, to talk about NRT. We don't talk about it enough because it really is quite miraculous. I absolutely, unreservedly suggest to anybody with any kind of physical and or psychological emotional affectation that Jess is probably able to help. You may have to wait a while though, because she's a busy lass, I can tell you, being one of only 20 in the world. But it's well worth getting in touch with Jess at the email at the bottom of the screen now. Don't forget, of course, you can also access the Fine product from the Cyril Company at the other address at the bottom of the screen there, directly from Jess. That'd be awesome. Just to thank her, if nothing else, for giving us her valuable time and telling us about all of this stuff. I guess you're the guest, Jess, so you get to finish us off with the final words.
Thanks for having me. You know I love speaking
Pleasure.
to you. And yeah, I think the widest message that I want people to know is that it isn't just a headache. It isn't just a digestive issue. It isn't just a muscle tight. Like, these are all symptoms of a weak nervous system and brain. And if you aren't able to resolve it yourself, it's likely you ever will be able to without getting some support and help. So give me a yell. Also, for people to know that there is more out there than what we currently understand or believe about human function. So ideally, we want to prevent you getting into a place that the tendon is so tight that it snaps, but in Bart's case. So preventative action is always the easiest. However, obviously, most of the time we do work with pretty chronically disabled and ill people.
Just purely, thank you for that, Jess, by the way. And I know I said you'd have the last word, but I just forgot about this. I thought I should tell you about it. This week, for the first time since I did my Achilles, I am able to walk up the flight of stairs in my house 12 steps on the ball of the injured leg, carrying my whole weight up the stairs.
Yay!
That's incredible.
Amazing.
Yeah.
And you don't even have a tendon attachment anymore. So.
Exactly. I've got a soleus, but not much of a calf anymore. So that's incredible that I can do that. Anyway, there it is. Yeah, cool.
Thanks for having me.
Awesome. Thanks for your time. Appreciate it very much, Jess. And we'll have you on again if, of course, the audience go, have her on again. Have her on again. Because they probably will say that, and we probably will do that. In the meantime, be good. Don't do anything I would do. Otherwise, guess who you get a visit from at late night? And he will bring his bucket of soapy frogs. Huh? Yeah, he lost an eye about 50 years ago.
Oh.
Some little bastard was teething and chewed it out of his fucking head.
Was it you?
He's never forgiven me for it. That's why he gives me so much shit.
Listen, babe, have a great day.
Yeah. All right, you too. Be good.
Ciao.
Thanks all. See you guys. Ciao for now.